Hey everybody, happy Wellness Wednesday. This is Marco Rodriguez coming at you. So I'm here today with a very special guest, Dr. Rigby Patterson. He's got over 35 years of medical experience. So Dr. Patterson, thank you so much for coming in. Really appreciate you taking the time out. I know you've got a very busy schedule. Tell us a little bit about your background.
Okay, I graduated from medical school in 1980. My residency I finished in 83. My training is in family practice, but I started in emergency medicine for 8 years, then flipped over into family practice, and did that for a total of 35 years.
Wow, okay. And so now you've become one of the most well-known biohacking physicians in this area. And tell us, why is biohacking, why did that become so important to you?
Well, you know, as a doctor, our whole purpose is trying to make people feel better or look better, not look better, feel better. And in the last 2 years of my practice, I came across biohacking, and I started using it haphazardly in my practice. You know, starting with chronic pain, and then I heard, hey, that works well in things like Alzheimer's. You know, nothing works there. Kidney failure, heart failure, anything that's associated with aging, biohacking tends to have a real impact. I mean, I was stunned with what I saw. After about 18 months of that, I thought, why am I a doctor when I can do more with biohacking?
Wow.
And so I quit my practice to biohack.
You quit your practice. That's amazing. So now you are a full-time biohacker. And it's working out for you?
It is. I've never seen, you know, we all want to affect people's health or people's well-being. And this is the best way I found to do it. And I love getting feedback from patients, from friends, from people who say, suddenly this is gone, or better, or I can handle this.
Anything that specifically stands out, results that you've seen that are, I mean, I know we don't claim that we treat, cure, or mitigate a disease, right? I mean, according to FDA regulation, we have to follow FDA regulations, but is there something that you've seen that just really blew your mind?
My heart failure patients. This was a man that had an output of 30% of his heart. You need 60 to be normal. The guy could not walk and talk. He couldn't sleep lying down. He couldn't wash his own hair because he couldn't pump blood up. We started him on this, scared half to death because he was on 30-odd pills a day for his heart.
Wow.
And didn't want to mess that up, but he tried it. 3 months into it, they repeated his cardiac function. It had gone from 30 to 53%.
Awesome. Wow.
He's suddenly walking on vacations with his family. He can wash his hair. He can sleep lying down. He can talk and walk at the same time. He can go outside and control his temperature, which he could.
Incredible. That is amazing.
He is now at 63%.
63%. So he started off at 30, and now he's at 63%.
He's the only human in recorded medical history to have done that with his diagnosis, and he's a case study at Johns Hopkins.
No kidding.
I didn't need to be a doctor to do that for him.
Absolutely.
His cardiologist told him not to do this. Now his cardiologist says, don't stop this.
I love it. And you know, we find that sometimes that happens a lot with health practitioners, because we get so focused on what we know, and we're almost fearful of anything that is outside of our paradigm. But you know, it's great that that particular physician really kind of saw the results. You can't argue with results, right?
No.
All right, fantastic. Well, Dr. Patterson, thank you so much. I really appreciate you taking time out to talk with us today. Hey guys, that concludes our Wednesday for today, our Wellness Wednesday for today. And remember, as I always like to say, there is a better way to live.